JP Kalita, a cardiac surgeon based in Guwahati, and he's Dr. Mayank Agarwal, he's a cardiologist. We are from one of the advanced center in the entire Northeast, advanced cardiac center of Northeast is Health City Hospital, Guwahati. Here we are going to discuss about a couple of important things what the advancement is happening in city of Guwahati, which is taking care of the whole and Northeast population in the cardiac field, both in surgical and cardiac intervention and other treatments. I do have one important observation also, which I'd like to emphasize here and to propagate this my observation through you electronic and print media, is that aortic diseases. Aorta is the largest vessel of our body, which goes out from the heart and it distributes blood to the whole of our body. So aortic diseases are common among naga population. It is location of this disease either can be inside the chest or in the abdomen, tummy region also. So I do have observation of aortic disease common among naga population based on a retrospective study of my more than a decade of practice in the cardiovascular field. And most of the patients, I analyzed nearly 20 patients which underwent operation itself. Aortic operation is a major operation, and 20 aortic surgery when I analyzed, what I found is that around 77% of these patients are from the state of Nagaland, and the rest are from the couple of from the Assam, and one or two patients is from Tripura. So what I have seen in not so deft in observation, but not so deft in the analysis, is that what are the possible causes for this disease. We have not done any kind of genetical study, we have not done any kind of research in the pathology field, but it has been seen that that can it be a kind of food habits, because we do know that our naga population, they are very fond of smoked food, or maybe long-term preserved food, or they do take a lot of meat, and they do take maybe fatty food. So is it can be something related to that? That is one observation, and that particular thing has to be really researched on, and government of Nagaland can take initiative on that. It can be a public-private collaboration research. Government of Nagaland can tie up with one of the busy center in the best in Dimapur or Kohima, where this people who have, if they get diagnosed with aortic diseases, then that can be researched on, analyzed on, then we'll be able to find out. Because if we do not intervene these patients on time, death rate of its complication is very high. Around 80% of the patient dies of if the aorta gets dilated and ruptures within 24 hours time. So we do not have time when we diagnose and the patient develop complications specially. So it has to be diagnosed little preemptively. And how do you diagnose this patient is that we can come up with some kind of screening program, screening of our population. Because in UK what we know is that all elderly patients above 65 years, they do go screening abdomen ultrasound to look for if any aortic disease in the abdomen is present. Likewise, they do go for an echocardiography of the chest also. So as we have observed that this disease is more common among this population, so can we come up with this kind of some criteria, like if anybody above 60 should we screen? Because in my analysis, what have seen is that majority patient was male patient, and 63 point some on an average age of this male population is 63 years. I mean, by 63 years they gets operated, and among female population the age is little lower. It is around 56 years. So if we can come up with some kind of like for male population we keep a cutoff age of 55 years onwards, we screen this population, at least go for one ultrasound, one echocardiography. For female patients, we start from 50 because they present early. So likewise, we have to do for an in-depth study of this disease, and that is how we can detect this kind of patient. We can prevent on the basis of the analysis where we find out from our research, and that is how we prevent a lot of deaths among this population.
So, sir, in Nagaland, where can we avail this treatment for?
Yeah, see, ultrasound is available in all district centers, at least. It may be in the subdivisional level also if any good clinical setup is there, so it is available. So doing an ultrasound of abdomen, tummy, and to detect it also is technically not very challenging. So if the ultrasound is available in district centers or a subdivisional level also, then it can be detected. For the thoracic aortic problem, echocardiography has to be available, and we need to have expertise on that. So as of now, what I can understand, maybe Dimapur here or in Kohima, definitely there will be a couple of centers where echocardiography is available. So that can be done through that.
Oh, so you specifically mentioned about food habits, which this is a cause of condition. So is there any possibilities we can control by itself in the food habits? Is there any chances that we can, if a person controls on his food habits, the disease will be lesser on the profound?
Yeah. So it is too early, I believe, to say something on that, because this is my observation based on only few patients, like around 20 patients. We need to have a bigger and in-depth analysis for that, and then we can able to come to a conclusion that specific food is causing this problem. But anyway, though we know that fermented food is good for health and boiled food is good for health, but smoked food may not be as good as boiled or fermented food. That can be avoided. That is what I believe myself. And other thing is that any food which increases the uric acid level, is not good for heart and blood vessels. So if possible, we need to avoid.
So can you mention that any that food causes any diseases that
Yeah, meat products, too much of meat products, red meat is not good for that. Okay.
What is symptoms?
So other. So usually and unfortunately, what happens? Many of these patients remain asymptomatic for quite a long period of time until this aorta really gets dilated big enough, it stretches the wall of the aorta, and they start developing symptoms. And these symptoms can be like vague pain in the tummy or the pain in the back of the that loin area. These are the usual presentation. Or if we touch the abdomen, we'll feel a pulsatile, expansile tumor kind of mass in tummy examination. And some patient, good number of patient, good percentage of patient, unfortunately, they do present with a rupture. Or if too much of pain is there, then we should suspect that already that complication has developed and a rupture is in. And coming back to one of your question, like how do you avail the investigation part? Investigation can be done echo and ultrasound, but the further treatment is important. And we do have particular sizes to cut marks are there. So anything above 3 centimeter in the size, this patient should be referred to a center where this operations or intervention has been performed. And it has to be a well experienced, well equipped center, so that safety of patient is we can maintain, and patient can come back safely out of the hospital. Dr. Mayank, would you like to say something?
Good evening, I'm Dr. Mayank Agarwal. I'm a consultant interventional cardiologist working at Health City Hospital. See, Dr. JP sir has well summarized about the aortic aneurysm and the disease of aorta. I would like to highlight your attention on cardiovascular disease. Cardiovascular disease is one of the most common cause of death worldwide, and India accounts for 1/5 of such death. And cardiovascular death, what we mean by cardiovascular diseases is that the heart attack, heart failure, or the arrhythmias. These are the diseases which comes under cardiovascular disease. And in India, the sad part is that younger populations are affecting more. The incidence that 10 years younger population of India are affected more with these cardiovascular diseases as compared to the Western population. And we all know young populations are the backbone of any development of any country. And for that reason, today I and Dr. J.P. Kalita sir and Dr. Atanu sir, we are here to conduct a CME on on early diagnosis and management of acute coronary syndrome. And it has been found that with early diagnosis and with proper management of cardiovascular diseases, we can prevent death to a larger extent. In the literature says that majority, more than 50% of the patients of a heart attack cannot reach the hospital. The most important reason is the lack of diagnosis, and the lack of diagnosis is because of lack of awareness. So through the print electronic media and through CMEs like this, our aim is to make people aware that with early diagnosis and timely management, we can suppress or we can prevent the death from cardiovascular disease. And we at Health City are doing that from the last 4 years, and till date we have done a successful and a very significant number of primary angioplasties and other cardiac related interventions and surgeries in context to that. And the most common causes that we have found, it is not that only in this part of the city, or it is all over the India, is stress. And second is our food habit and the addiction habit. And smoking is one of the most important cause. Even at as early as 30 years of age, with no any other risk factor, we think that if we have diabetes, hypertension, then only we are going to suffer a heart attack. But it is not the case. Recently only, like last week only, we have come across the patient from this part only, 30-year-old gentleman with smoking history, and there was a massive 90% blockage in his main artery. So with timely intervention and these are the factors which we can stop it. Like smoking is in our hand. Like diabetes, we can control it. We can't stop having to suffer from diabetes. So if such preventable factors, if timely can be taken care of, then we can prevent a large number of death, and especially in the younger population.